All right. It looks like, the people coming in are slowing down, so I'll have my colleague Ashley here to let people in as they come, but we can get started. I just want to say thank you to everybody for being here. Good afternoon, and my name is Farah Jalul Rizat, and I serve as your Chief Pharmacy Officer for the Michigan Pharmacists Association. On behalf of the Michigan Pharmacists Association, I'm pleased to welcome you to today's COVID-19 vaccine town hall meeting. Hosted in partnership with the Michigan Department of Health and Human Services, MDHHS for short, and Dr. Natasha Bagdasarian, our state's Chief Medical Executive Officer. We're also fortunate to have colleagues from the department, including Dr. Sarah Lyon-Kello, our Senior Director of Public Health Administration for the Michigan Department of Health and Human Services, Laura Hall, the Director of the Department of Insurance and Financial Services, DIFS, and Courtney Pendleton, COO of the Department of Licensing and Regulatory Affairs, LARA, and Amy Gumbrecht, the Director of LARA. Thank you to our guests. Your presence underscores the importance of a collaborative approach as we continue to respond to the ongoing challenges of COVID. This session is designed specifically for Michigan pharmacists and pharmacy extenders, including pharmacy technicians and student pharmacists, where we will discuss ways pharmacists can continue to protect our communities. We encourage your questions and engagement throughout the call, so please feel free to put it in the chat or raise your hand, and we would be happy to address any questions that come along. With that, let's begin by welcoming Dr. B to share key updates from MDHHS.
Hi, everyone. Good afternoon. I'm so glad to be here with you all. I don't often get to talk to so many pharmacists in the state of Michigan. Usually I'm just talking to my one pharmacist who fills my prescriptions, but I'm so glad to be here with all of you. And I want to just start out by saying thank you for everything you do. I will never forget the year I took my son to a pharmacy for the first time to get his COVID vaccine. He was, I think, in third or fourth grade, and we literally had to chase him around a CVS or Walgreens and tackle him a little bit. And I thought to myself, this poor pharmacist did not sign up for this job. So maybe that pharmacist is on this call. If you are, thank you. If you are not on this call, I'm sure many of the pharmacists here have also immunized kids who are not very happy about it. And thank you for everything you do. Thank you for being our partners in all of these things. I'm going to share a few slides, very, very few slides. I just want to give you a little bit of an overview of what we are talking about today. With vaccines, can you see my slide okay? Okay, great. So when I think about COVID-19 vaccination in 2025, there is a lot of noise out there. There's a lot happening at the federal level, and it's hard to sort out everything that's happening. I typically group things into three buckets: guidance, coverage, availability. And just to summarize, in terms of guidance, our guidance for COVID-19 vaccination is in alignment with all of the major national organizations. So AAP, AAFP, and ACOG have all issued their guidance. ACP and IDSA are coming next, but we're in alignment with all of those national organizations. And I'll show you a little bit about what that guidance looks like. For coverage, as of today, there should be no major changes in coverage for COVID vaccines. But of course, we've got our friends from DIFS here to talk about that a little bit further. And then in terms of availability, the FDA label, I know, created some problems for many of you. And we have potentially a tool that some of you may be able to use to clarify that FDA label change and what it means. So this is not our final guidance document, which is still going through our approvals process, but we have a guidance document that will look very similar to this coming out. Of course, flu and RSV, you know, nothing majorly has changed. For COVID vaccine, this is the language for infants and children from AAP and AAFP. Essentially, if you're under the age of 2, if you have a high-risk condition, or if your parent wants you vaccinated, you should be able to get vaccinated. Pregnancy, adults over 50, all. And again, this is advice from ACOG and AAFP. So we are in alignment with those major national organizations. In terms of MDHHS guidance, we did put out a press release, and this QR code will take you to that press release. If you're looking for that sort of documentation or proof of what the state is recommending, this is going to be updated hopefully in the very near future. But this is the guidance that we issued in July that was, again, in line with those national organizations. So please feel free to take a picture of that QR code and go to that site. Now, on Friday, we issued an extra piece of guidance, and this is only meant to be helpful. If it is not helpful for you, feel free to ignore it. This is a standing recommendation. And what this recommendation says, that if you are over the age of 6 months and you don't have a contraindication to vaccines, so you don't have an allergy or another history of an adverse event, and you have not received this year's COVID vaccine, we would consider that a condition that puts you at high risk for severe outcomes because the data is clear. If you have not had your annual COVID vaccine because of waning immunity and changes in variants, your risk goes up for hospitalization, for urgent care visits, for emergency department visits, and even for death. So based on science, data from last year and from years past, we've issued the standing recommendation. What does this mean for you? If you don't think this is helpful, you can feel free to disregard it. Nobody has to use this. This is only meant to be helpful for those who wish to use this. But what it does is it establishes that in Michigan, this is our recommendation. This can be considered a standard of care, that if you have not received this year's COVID vaccination, you may be considered at higher risk for those severe outcomes. This means that a patient, if they have to do a self-attestation, can check that box. If they are choosing to be vaccinated, they can check that box based on the fact that they have not yet received this year's COVID vaccination. And if you are working in a pharmacy, you also can use this for your interpretation of that FDA label change for high-risk condition. You don't have to. Nobody has to. Nobody is enforcing this. Nobody is forcing you to use this. But this is a way that we are trying to be helpful for those who are seeking further clarification. Again, there's a QR code. Feel free to go to that webpage, print it out, share it with your networks. And I think that's all I have in terms of my slides. And I think, Farah, I'll turn it back over to you for questions.
Yes, thank you so much. So we've had some individuals submit some questions, but I'll also first open it up to the floor to see if there's anybody else that has any additional questions. I do see one in the chat. What about those living with someone at a higher risk, like an immunocompromised individual?
Absolutely. Again, we feel that everyone has different risk factors. I've been saying on interviews and to the media that people have different reasons for wanting to be vaccinated. They could be, I don't want my kids to miss school this cold and flu season. I have a family vacation planned and I want to make sure we're all healthy to go on this family vacation. It could be my sister's getting married next month and I want to make sure we're all healthy for her wedding. It could be grandma is on chemotherapy. Whatever your reasons are, this is going to offer you protection from those severe outcomes. And we believe that the vaccine should be available to you based on the data and based on recommendations from those organizations, AAP, AAFP, and ACOG.
Thank you for that. There's another question in the chat. Would that recommendation still apply to individuals with a recent COVID-19 infection in the past 3 months?
So if you notice the language, it is that these individuals may be considered high risk. So if you feel that someone recently had COVID and your recommendation is that they wait, you may make that recommendation. This is meant to be an addition piece of support. If you want to consider someone high risk or they want to consider themselves high risk because they want those protections, you may, but this is not meant to force you into doing anything that is outside of your clinical judgment.
Thank you. And I think you talked about the key, like clinical judgment, because it is also up to you as a pharmacist whether you want to. It's nothing is forcing you to administer. So you are the one that's actually reviewing the patient's data and making sure that they actually qualify for that prescription.
Yeah,
Um,
Farah, I think it's really key that you're mentioning choice because there's choice all around. We want patients to feel good about the choice they are making to protect themselves and their families. We want to empower them. We want to empower clinicians, again, to make choices based on their clinical decision making. And of course, every pharmacy chain has their own policies and their own regulations, and they can continue to make their policies. But our recommendation is that if folks want to reduce their risk of COVID, they may check that box and say that I am at higher risk because I'm unvaccinated.
Thank you for that. So we kind of briefly chatted about this at a different on a different call, but those that have I'm sorry, that are immunocompromised individuals and that require an extra dose. The current, guidance for the CDC guidance is for the 2024-2025 vaccine, and there's nothing out there yet for the 2025-2026 for a second dose. So, what would you recommend for those?
I would recommend continuing to adhere to those recommendations from last year. They do mention the 2024-2025 dose, but of course you would give the 25-26 dose. And we do anticipate that IDSA, the Infectious Disease Society of America, will be issuing recommendations for immunocompromised hosts later on this fall.
I have one from Haneri, and I might need you to jump in and ask your question. What should that box that they have to check state? Are you talking about like an attestation, like a self attestation being high risk? Yes, it looks like she can't get on. But yeah, so if somebody has a what self-reported high risk documentation, how would you recommend the pharmacy maintain that documentation?
So, in terms of documentation, that is up to pharmacies, to those pharmacy chains, to regional directives. However, your organization has chosen to document that. People are choosing some organizations are choosing to document, some are choosing not to document. This really has to do with how your organization interprets the needs around that FDA label. That's something I can't comment on, but I'm trying to give you a little bit of clarity on what high risk means because the FDA does not define high risk. They point to the CDC, and the CDC has a very broad list that includes things like obesity, inactivity, diabetes, any heart disease, any lung disease. So most people, based on those things, would fall under that high risk category. It's just that there are some others who aren't sure. There are other folks who are not sure. Um, I personally think that, I'm here sitting on Zoom meetings for 8 hours every day. I know I'm not getting my steps in today, and that should qualify me for a COVID vaccine. But I know that there are both patients and providers who feel some hesitation. And so that standing recommendation is meant to give you a little bit of clarity because the CDC list is not comprehensive, it does not exclude anything. We're giving you the further clarity to say if someone has not received their shot, you may consider that being a high risk condition.
And those references are in the recommendation.
And I don't know if you heard Sarah, but those references are in the recommendation.
Thank you for that. Tony said, and I already kind of answered in the chat for him, but maybe you can provide additional information. Do we use Dr. Bagdasarian as the prescriber on our prescription? It is a no. And if you want to just kind of explain why you have not issued a standing order for this, like other states have.
So, in conversations with many of you all and with your organizations, what we heard is that a standing recommendation might not be helpful in the state of Michigan, and that did I say standing recommendation? I meant standing order might not be helpful in the state of Michigan, but I also heard feedback that a standing recommendation could be helpful. So again, we're trying to provide direction, guidance, clarity that is helpful. If there are more things that are needed, I really need to hear your feedback and your input. because I need to know how to make your lives easier. Let me know how we can best support you.
Thank you for that. I think our friends at Laura are getting a little bored, so let me give them a question for now. So when can we expect the implementation of Senate Bill 219, which authorizes pharmacists to have an independent prescribing scope of immunizations and point of care testing and treatment?
Yeah, thanks, Farah. And we're never bored. This is all very fascinating, but thank you for getting us in here. Just a quick introduction. My name is Amy Gumbrecht. I'm the director of the Bureau of Professional Licensing here over at Laura. So we are the bureau that oversees most of the health professionals in the state of Michigan, including pharmacists. So it's nice to see so many of our licensees here, and also shout out to our board chair, Ronnie, who I know is here as well. So to the question, we are in progress on implementing Senate Bill 219. So as Farah just mentioned, Senate Bill 219 is a bill that was passed by the legislature, signed by the governor, that would allow pharmacists to prescribe immunizations themselves rather than needing a collaborative practice agreement, and also provide some testing and treatment on site. So the long story, I'll try to shorten as much as possible. We were actually almost completed with the rules to include that bill. But then the legislature also passed another bill that would permit pharmacists to prescribe and dispense contraceptives. So we wanted to make sure that we got that language in there as well, because that's also important. So we are in the process of working on that. The public hearing on the rule set was completed on September 10th, which I believe during that we received about 10 to 15 comments. And so the next step in the process is that the board's rules committee will go over those comments and decide if they need to make changes or not. That rules committee is meeting next on October 3rd. If you have interest in joining that, we have all of our meetings available virtually. If that's something you'd like to join, that is all available on our website. So we're closer to the end. Once the rules are promulgated, we will send out a message to all of our pharmacy licensed to ensure you're aware. Our goal this whole time is to have had the rules through our process by the end of the year, which I think we're definitely on track for. And then it'll have to go through the Joint Committee on Administrative Rules process, which is a legislative process. But we are on track. So that's where we're at right now.
Awesome, thank you. So from the licensing perspective, if you were to, let's say, receive a complaint, what would you do? Would you take into consideration the CME's standing recommendation? And I guess it's a twofer. What action is Laura taking in response to the executive directive that was issued by the governor's office?
Yeah, great. I'll take the first question, and then I think Courtney will probably step in for the second one. So in regards to a complaint, so the question was, would you take into consideration the chief medical officer or executive's standing recommendation, which absolutely we would take that into account. We work with our partners at MDHHS often, as well as our other sister departments. I thought it might be helpful to kind of talk through what happens when we receive a complaint. So hopefully most of you haven't been through that process. So if you're not familiar, or maybe this will provide some important context that's just helpful to understand. So all of our health professional complaints are reviewed by that respective profession's board review panel. This is required by law. Any complaint we receive, we have to have, on the health side, have to have a board review panel look at it. So the board review panel is made up of 3 members from the board. So in your case, it'd be the Board of Pharmacy. That board review panel reviews the complaint, and then those 3 members, by a majority, decide if there is a possible violation of the public health code. If the panel determines there might be a possible violation, then an investigation is authorized and begins. And so that's when our staff gets involved and, would probably be reaching out to the licensee or, whoever submitted the complaint to get more information. So what I would say in this scenario is, in the event that a complaint would make it past the board review panel and comes to an investigation, you would absolutely consider and review the standing recommendation. And then Courtney, do you want to take in on the other one?
Sure. Thanks, Amy. Good afternoon, everyone. My name is Courtney Pendleton, and I serve as the Chief Operating Officer for Laura. Thanks for having us here today. And if it's your lunch hour, thanks for spending your lunchtime with us. So as far as what Laura is doing in response to the executive directive that was issued by the governor, we are currently reviewing all of that that ED, what we call an ED, with our legal counsel. And so looking at where our authority is to make recommendations, changes, But most importantly, we are sharing information. So not only are we joining you in this conversation today, but we are in regular communication with our colleagues at MDHHS and DIFs about what we can do together. One of the biggest things that we did last week was share the standing recommendation with our licensees. That went out to little over 400,000 licensees, including yourselves. So if you didn't get that, please make sure your email address is current in MyPlus, so that you can make sure that you get that information. And so that's some of the things that we're doing. Frankly, that's one of the easiest things we can do, is make sure that we're sharing that communication. So we continue to dig into that and see what else we're able to do with that ED.
Thank you. Thank you so much. So I'll turf that over to Laura again. Same question. What are you guys doing with the executive order?
Thank you. I'm Laura Hall. I'm the Deputy Director at the Department of Insurance and Financial Services. Also, thank you all for being here and for including us. We of course support access to insurance coverage for preventive care that helps improve health outcomes. Under the executive directive, similar to our friends at Lara, we are reviewing our authority and the steps we can take to clear barriers, unnecessary barriers to COVID-19 vaccines for those who want them. I'll mention, you may have seen in the media, several insurers have already committed to continuing to provide this coverage. And we are looking at the steps we can take to help clarify and make sure that Michiganders, yourselves, providers, insurers all understand the expectations under the law at this time.
Thank you for that. Again, another question that we got is, how can pharmacists navigate situations where patients encounter coverage denials or high copays for a COVID vaccine?
Yeah, so we always encourage individuals to first try to work with their health insurer to understand if there was a mix-up or something that can be resolved. But we are here, we have an amazing Office of Consumer Services that is here to help with concerns related to health insurance. We have a live call center Monday through Friday, open from 8 a.m. to 5 p.m. at 877-999-6442, which I'll drop in the chat. We also take complaints online at michigan.gov/diffs complaints. So if you have an individual who can't get assistance or who can't get their issue resolved through their health insurer directly, please encourage them to contact us. Our goal, we're always trying to get more calls and keep that team more busy than they already are to help Michiganders who are having problems with their insurance.
Thank you. I guess still in that topic of underinsured folks, can someone from the department, maybe Dr. Lyon-Callow, discuss how can pharmacists become involved in Vaccine for Children program, and maybe just briefly go over what that is? And I don't know if that's, sorry to put you on the spot.
Well, actually, what I'd like to do is turn it over to Ryan Malash, who is our immunization director and is very, very familiar with VFCs.
Hi, Ryan.
Everyone. Yeah. So we are happy to, enroll pharmacies in the Vaccines for Children program. The process would look like you would reach out to your local health department first, as they are the ones who are going to do a site visit. They'll contact us. We'll have some conversations. Our VFC team will probably have some conversations with your team in your pharmacy. And, there's some startup stuff that we have to figure out in terms of like, what kind of refrigerator do you have in your facility? Are you, taking daily temp monitoring, like twice a day kind of thing? Then we'll do it. The local health department would do a site visit. We'd get you set up in MICR to do some ordering. And then, you could just be free to order those vaccines through the VFC program. Obviously, most of the VFC vaccines are for children that are less than 3 years old, because that's where most of the routine immunizations happen at that younger age group. So what we have is a special arrangement called a VFC specialty provider. And since you would only be offering vaccines for the eligible population that you serve, that would be children over 3 and adults. And so we can think about how that would work going forward, and which vaccines you'd like to offer. It would probably take, some time to get set up. But this is something that is happening kind of across the country. We've actually tried to get this going with a handful of independent pharmacies. And it's been a little bit of a struggle. People get halfway through the process and then decide that it's a little bit too arduous. There is a lot of requirements. There's a lot of documentation that needs to happen. And so we can talk through what all that would look like if you're interested. I would just say, please reach out to your local health department in whatever, wherever you are, and they can help start the process.
Thank you for that. I appreciate it. And if you guys have any questions regarding how to connect with a local health department, please feel free to reach out to MPA. We're a resource that could connect you with a local health or somebody that truly understands what the needs are and how they can help you on board with that VFC. So this is a question maybe now to Sarah. Sorry. During the pandemic, we had a statewide dashboard that helped patients find providers offering a COVID-19 vaccine. Are there plans to continue this or possibly expand on that tool for other vaccines to help the public basically increase access?
Yeah, so that tool was very specific to COVID and it has come down now. It was put together using a lot of federal support, ongoing federal support for COVID. So no, we do not have a tool like that and are not anticipating developing one. I know, Ryan, is there anything else you wanted to say here? We were talking earlier about some of the steps.
One of the things we are doing, because we don't have insight for private ordering, right? So some of that, all of the public doses are monitored the inventories are monitored through our immunization registry. But we don't see a lot of the exclusively private providers. We won't see a lot of their inventory. And so what we do have is, and what we're working to make public now, is a map of all of our VFC providers in the state, and including some spots where there are deserts. What we really want to look at is places where there is less access to VFC providers, so that we can target those areas to enroll new providers. So that's kind of the purpose of this map that we're putting together. But what we can do is you can see when you look at that map, you'll be able to see the physical location of all of the VFC providers in the state. All of those providers are strongly encouraged to carry COVID vaccine. And I think phase 2 of this map might include some information about about the COVID vaccine that they have available if they've ordered vaccine through the VFC program. So that is the one thing that we can do. But we won't be able to have like a vaccine finder, all that was done at the federal level, as Sarah mentioned. So
It was a good tool. It's okay though.
yeah.
Speaking of another tool, we have our MICR in Michigan. Is there anything, any upcoming improvements that are happening to MICR that could streamline some of the reporting?
Well, we are actively working to modernize MICR. We have selected a new vendor. We are going through the process of making sure all of our ducks are in a row to migrate all of our data over to that new system. And that system should have additional sort of interoperability is the kind of the buzzword that we use around here a lot. So it should talk to other systems a bit better. Our new vendor is actually STC Health, and STC Health is also happens to be one of the EHR vendors for a lot of corporate pharmacies. And so we're anticipating that there will be smoother connections and more modern ways to sort of interact with other data systems. But all of that will be happening sort of in the March of next year timeframe is when we'll go live with that new system. So for now, we are just continuing to support the existing system, and those connections should work if you set them up during COVID to report the immunizations during the pandemic to report the COVID immunizations that were being administered. Those connections should still continue to work. And moving into the new system, there should be nothing that the provider has to do to sort of reinvigorate those connections. It should all sort of happen in the background or with some specific EHR vendors. So we are hopeful that it will be minimal impact when we transition to the new system for the providers in the field.
That's awesome. Thank you. Thank you so much. This is all the questions that I kind of have. Maybe we can recap just where do you think pharmacy can, or pharmacist outreach could have the greatest impact right now? In what region? Any words of wisdom that you can just give us today?
You know, if you take a look at, we still have publicly available information on COVID vaccines and uptake, and where in the state we see greater uptake, less uptake, in which demographic. And so if you take a look at a map of Michigan, you will see that there are many areas that have lower vaccine uptake. So it's best to take a look at your county and see where it lies. But what I will say in terms of demographics, those over the age of 65 are super duper vaccinators. They love to get their vaccines, including flu and COVID. And the younger you are, the less likely you are to get vaccinated. So we particularly see less uptake for our littles. And I know that many pharmacies aren't vaccinating some of the littles, but you are vaccinating a lot of kids. You are vaccinating a lot of folks in their 20s and 30s. And so whatever you can do to, again, put that message out there about vaccines being safe, that they're still recommended. There's a lot of chatter right now, but these are still the best way to stay out of the hospital, out of the emergency department, and out of urgent cares. The best way for your kids not to miss school this winter season. If you can continue to push those messages, that would be very helpful. I'm also going to put a link in the chat about the Michigan Health Communications Initiative with a QR code, so you can sign up for, and maybe April could do that while I'm talking. So you can sign up for newsletters about what people in Michigan are hearing about topics like vaccines. There's a lot of misinformation out there. We also have unbranded social media content that then you can post, because you are the leaders. You are, the healthcare messengers for your communities, not just for the patients you see in the pharmacy, but for your families, for your neighbors, for your loved ones. They want to hear from you, your messaging about vaccines. So if you're posting things on your social media, they're much more likely to listen than things we're posting. So we'll put a link in the chat for that. And again, I just want to thank all of the pharmacists out there for the terrific work you do every day in supporting vaccination.
Thank you. Thank you so much. I feel like everything in the chat has been answered. If anybody else has any additional questions, you can just reach out to the MPA. As we wrap up, I just want to extend a heartfelt thank you to Dr. B and her leadership, and our colleagues from MDHHS, DIFS, and LARA, and most importantly to all of you, the Michigan pharmacists that are actually doing the job. Your commitment on the front lines of COVID response has continuously to make a measurable difference in the health of our communities. So hopefully we'll be working with our friends at MDHHS to turn whatever questions came into as a FAQ, I'm sorry, and we'll post it on our website. So hopefully we'll have that. We'll have a recording as well to share with you. So on behalf of the MPA, thank you for your dedication and for spending time with us today. Stay safe and keep up the incredible work you do every day. Thank you so much, everyone. Take care.